All right. Hello, everybody. We're going to go ahead and get started. So, my name is Savannah. I'm on the marketing team here at Seaview Orthopedics. I just want to thank everybody for joining us tonight. For those who might be new here, we do host these patient-focused virtual education seminars every other month with different physicians in our practice. If you want to stay up to date on those, you can check out our website, www.cviewortho.com, and look at upcoming events under the About tab. We also announce all of our events and create educational content on our social media profiles, so you can follow us there at Seaview Ortho on Facebook, Instagram, and TikTok. So just a little bit about the practice. We have been in practice for over 40 years, proudly providing quality orthopedic care to Ocean, Monmouth, and Middlesex counties. We have 6 offices located in Ocean, Brick, Barnegat, Holmdel, Freehold, and Monroe, with 31 doctors and counting, one of whom is, of course, with us today. So I'd like to introduce you all to Dr. Kenneth Chern of the Seaview Sports Medicine team. He is a fellowship-trained, board-certified orthopedic surgeon, is currently a partner of Seaview Orthopedics, and also serves as the Chief Information Officer for the group. He has been annually selected by his peers as one of New Jersey Monthly Magazine's top docs. Dr. Chern attended Princeton University, where he graduated with high honors and was elected to Phi Beta Kappa, America's most prestigious academic honor society. His next stop was New York City, where he went on to attend Columbia University College of Physicians and Surgeons. After orthopedic surgery residency, Dr. Chern completed a fellowship in sports medicine and arthroscopic surgery at the Baptist Hospital in Nashville, Tennessee, where he trains in advanced arthroscopic techniques for treating sports injuries, including hip arthroscopy. Dr. Chern has specific expertise in surgery of the shoulder, knee, and hip, performing surgeries such as rotator cuff repairs, ACL repairs, cartilage resurfacing, labral repair and reconstruction, and of course, PRP, platelet-rich plasma injections for various musculoskeletal injuries and osteoarthritis. So we're going to get to the reason we're all here in a minute, but I do have to lay some ground rules. So please make sure that your microphones are muted throughout the entire presentation. There will be plenty of time at the end for the questions. So if you think of anything during the presentation that comes up, you can feel free to type them in the chat to be answered later, or when we move to the question and answer portion, you can go ahead and unmute your mic once I say it's okay. And the presentation will also be recorded to you and sent to you through your email, so be on the lookout for that before the end of the week. So without further ado, I'm going to pass the baton over to Dr. Chern.
Turn my volume. Well, thanks for joining us. Today, we're going to be talking about orthobiologics. Now, that is a term that I feel is the appropriate term to apply to the topic, but you may have also heard about orthobiologics being talked about as regenerative medicine. Okay, so the objectives of this talk today are to review the preparation and delivery of orthobiologics, specifically platelet-rich plasma and stem cells. And we're also going to review the applications of these two technologies in treating musculoskeletal injuries and conditions. So let's define orthobiologics. It's as I said before, it's some people refer to it as regenerative medicine. That is probably a misnomer because, as we'll find out in this talk, it's less regenerative than symptom treating. We're treating pain, and we're not really growing back parts of the body, as it can be claimed by some other people who give these types of injections. Okay, so orthobiologics are cells or substances and materials that are naturally found in the body. So the technology is to concentrate these factors, whether they're cells, substances, and obtain them in higher concentrations that are than are normally found in the body. And so when we kind of inject these orthobiologics to sites of injury, they help that site of injury heal, and it also can improve the quality of healing. And so for today, although there are many examples of orthobiologics, we will focus on specifically on platelet-rich plasma and stem cells, which I think all of you are familiar with. So a bit of a warning, there is, I think, in this field over commercialization. I think there are these technologies are now being directly marketed to individuals. And so we have to dispel some myths, some claims that you may find on billboards and newspaper advertisements. And that is that we don't grow back tissue. Okay, we basically are treating pain, and we'll get further into that. So the FDA has they're the official people who are in charge of regulating this huge market, and it's growing like wildfire. I think there are a lot of different people who may or may not be qualified are doing these types of injections. So this is an FDA statement, although they stating that although they see the usefulness of this type of technology, they are disturbed that sometimes that these technologies are basically being advertised as doing things that they are not capable of doing. So they are really trying to police all of this. So what we do at Seaview Orthopedics is that we're orthopedic surgeons. We're also other medical doctors in the group, and we basically are proud of ourselves because we practice evidence-based medicine. In order for us to recommend a treatment, we have to find something that shows that whatever treatment we're giving works, and we look to the medical literature. Now, there are other clinics that don't have as high of a standard, and also whereas if you failed any type of treatment we give you, there's usually somebody in the practice who can take care of the problem. And some of these injection places that only do PRP, only do stem cells, I think can only, if what they do doesn't work, they basically tell you that there's nothing else that they can do for you. If you fail any of these treatments in our practice, we also do hip, knee, shoulder replacements. And so we basically are capable of providing a very complete package of care. So what is platelet-rich plasma? Well, if you take a sample of your blood that we draw and we place it in a centrifuge, the blood actually separates into different parts. One part consists mainly of red blood cells. Those are the cells in your blood that carry oxygen. One fraction that we get are the white blood cells. They're the cells that float around in your blood that fight infection. Okay, and then there's also a platelets. And so we'll talk about these platelets, these magical platelets. So this slide reviews the process of drawing the blood, spinning it in a centrifuge, and then taking off only the part of the blood that is concentrated with platelets. Okay, so what do platelets do? Well, traditionally, typically they make a clot at a site of injury. For example, if you cut yourself, it's the platelets that hone in on the site of injury, and they make the clot. But after they make the clot, they also can secrete different factors, growth factors that attract other cells to come in and do the healing. This is a list of the different compounds that platelets can secrete in the area of injury. Okay, and these are the different compounds that can promote healing if available in high concentration. Let's talk about stem cells. There's two different types of stem cells. They're embryonic stem cells, and they're adult stem cells called mesenchymal stem cells. Now, in the Bush administration, in the second Bush administration, the use of embryonic stem cells in this country was outlawed. You can find that other countries do allow experimentation and treatment with embryonic stem cells, but we do not have those available for treating patients in this country. So when we say stem cells in this country, we're basically talking about stem cells from an adult, not from an embryo. So this is let's kind of forward go for it. I don't, these stem cells are mostly derived from two sources. They come from bone marrow, usually from the area of your pelvis by your hip, called the iliac crest, okay? Or these stem cells, these adult stem cells, can also be derived from fat, and most commonly from the abdomen. We all have a little bit of subcutaneous fat in our tummy area, and it's basically through kind of a mini liposuction technique that we harvest these cells and we use them to treat different orthopedic conditions. Okay, so bone marrow aspirate is basically derived from placing a needle into the iliac crest or part of your pelvic bone and drawing out the bone marrow. And then this is spun, and then the stem cells are basically harvested from this harvest sample. But that's a somewhat painful procedure. It's not something that's easily done in the office setting. So then the other type of stem cells is called adipose stem cells, or stem cells from fat. So basically, this is a depiction of a patient who's laying on his back, and we're using negative pressure in a syringe to pull fat cells out of that subcutaneous fat. And then these fat cells, which do contain a good percentage of or high concentration of stem cells, are treated in a mechanical factor, and they're disrupted with these metal marbles. Okay, and so this is basically a technique to obtain highly concentrated stem cells from the fat around your belly. Let's talk about what happens to these mesenchymal cells, these stem cells, after they're injected, for example, at a site of injury, whether into a knee for arthritis or into an elbow for tendonitis. They go to the active site, but then they fade away pretty rapidly. Okay, they do secrete these bioactive factors that stimulate other stem cells in your body to come and concentrate themselves at a site of injury. And one thing that they do is they decrease inflammation. Inflammation is a common pain generator in a lot of musculoskeletal injuries, and they possibly make healing tissue. So that's kind of a possibility. It's not known for sure that stem cells produce new tissue, but they can boost healing. So let's talk about different conditions where we can use orthobiologics. Okay, in the case of tennis elbow, which is a very painful condition that develops on the outside of your elbow, with playing tennis, if you're hitting your backhand not in a good biomechanical way, but you have a faulty technique, that can lead to stretching of the forearm muscles. They are all anchored right at the tip of this bone called the epicondyle. So that anchor point can develop inflammation and tendonitis. And then you start having pain with gripping, cocking a wrist, grasping, shaking hands, for example. So the usual treatment for that condition, and it's very important that we start, at the beginning. Not every person who comes in the office that is seen to have this condition of tennis elbow needs a PRP injection or stem cell injection right away. They should really be treated in the usual traditional manner with relative rest, avoiding the activities that hurt, taking some non-steroidal anti-inflammatory medications such as Motrin, ibuprofen, Aleve, and having some physical therapy to do some stretching and some special strengthening exercises called eccentric exercises. And most people with this condition, they get better with these incipient treatments, but they can use bracing. Okay, so this is a counterforce brace that can be helpful in tennis elbow. You can have cortisone injections, but there's a limit of how many cortisone injections you can get. We usually stop at 2 or 3. Any more than that can actually be harmful. So once a patient fails all of these treatments, that's when I offer them PRP injections. PRP injections do help this condition. There's no advantage of doing stem cells in this situation for tennis elbow because there's a significant difference in cost. PRP is much more reasonable than stem cells. And unfortunately, no insurances cover either PRP or stem cells. It's strictly an out-of-pocket expense. So I think the right thing to do is to try conservative treatment before we offer this type of, out-of-pocket expense for our patients. Now, there's another condition called patellotendinitis, and it's commonly referred to as jumper's knee. Basketball players get it a lot. When they jump and land, that's very stressful. The patellar tendon, which helps you straighten out your knee. As you can see in this MRI, there's swelling of the tendon there. And conservative treatment works out well in the same manner that you treat tennis elbow. You would do the similar things for patellar tendonitis. You can do physical therapy for eccentric exercise. You can take anti-inflammatory medications, and most of the time, the condition gets better. But sometimes this condition can come back multiple times, and then that's when you start considering a PRP injection or stem cells for this condition. Well, stem cells and platelet-rich plasma are also useful in treating knee arthritis when the patient has done their usual conservative treatment, which would be things like home exercises, going to physical therapy, developing a home exercise program to strengthen the quadriceps or the muscle in front of the thigh, stretching the hamstrings, and taking anti-inflammatory medications. Cortisone injections can be given into the knee joint to help the arthritic pain. The pain in arthritis is mostly from inflammation of the knee. There's a lining on the interior of the knee called the synovium, and when that gets inflamed, there's pain associated. The fundamental problem with osteoarthritis is that the cushion that is bonded to the ends of the bones that help the bone surfaces move smoothly when you straighten and bend your knee deteriorates. That tissue is called cartilage, and unfortunately, with aging and use over the lifetime, you develop these erosions in the cartilage. You lose the cushion. That increases the friction in the knee when these bone and joint surfaces move against each other, and that causes inflammation. And that's why people get pain from this wear and tear of the cartilage, leading to osteoarthritis. There are claims that I have heard of, whether in airline literature. You pick up the airline magazine. Have you guys seen that? You pick up whatever the magazine on the airline, and then you see all these ads for these treatments that grow back cartilage. But that there's no scientific proof that anything we can inject in the knee will grow back cartilage. But when we do recommend PRP or stem cells for knee arthritis, it's not growing back the cushion, the cartilage. It's just really just helping decrease the inflammation. So this is a normal synovium. So this is an arthroscopic picture of the knee up top here. And this is normal synovium. The lining of your knee should be pinkish, but once it gets very inflamed, it gets thickened. It gets red, and that's what we call inflammation or synovitis of the knee. So the non-operative treatment that should always be attempted initially is weight loss, which easier said than done, but that helps take stress off the knee joint. Activity modification. I have to tell some of my patients that they really shouldn't run on cement anymore, cement surfaces or pavement anymore. So if you have osteoarthritis, not a good idea probably to do any high impact activity. So we try to have people modify their activities. We ask them to ice the knee, take non-steroidal anti-inflammatory medications, whether over-the-counter medications such as ibuprofen and Motrin, or there's also a stronger prescription non-steroidal anti-inflammatory medications. Physical therapy helps, bracing can help. But once the patient fails all these, and also cortisone injections, we can also do the gel injections, viscose supplementation. We put a gel inside the knee that helps lubricate the knee, make the knee surfaces that are getting rough and worn out move more smoothly, and also to give a little cushion in between the bones. Or we can do our orthobiologics, which is the endpoint, because it's out of pocket. So we save that in our practice. We save that for last. That's not the first thing you are offered when you first come in to see us. So how does PRP or stem cells, for that matter, work in improving the symptoms of osteoarthritis? It basically modifies the symptoms. It lessens the inflammation that you have with osteoarthritis. It does not modify the structure of the knee. It does not grow back cartilage. It does not reverse cartilage damage. Unfortunately, we don't have that technology yet. And I think anybody who makes that claim, you have to be a little suspicious about. I mean, there are some studies showing that it may grow back cartilage, but there's not really enough evidence in the literature from clinical studies that we can recommend the treatment with PRP or stem cells for growing back cartilage. It just decreases inflammation and help your knee feel better, but it does not grow back cartilage. This is just basically the science of how PRP and stem cells decrease inflammation. They basically inhibit these enzymes that occur naturally that will break down the cartilage in your knee. So there is evidence that the PRP does work for knee arthritis. There's some studies, they're very good studies, what we call level 1. That's the highest grade of a scientific study that show PRP can be better than viscosupplementation or those gel injections. So there's also some evidence that the bone marrow aspirate can help arthritis, but I don't really recommend that kind of treatment to patients because it's just much more painful to harvest that bone marrow, which contains the stem cells. Let's talk about the shoulder. You all, I think, are familiar with rotator cuff injuries. I think if you're told that you can have an injection and that will heal a rotator cuff tear, I think that's more scientific. I mean, that's more science fiction than reality. I would say that even if you have surgery to repair your rotator cuff, in some cases, the failure rate of the repair is about 40 to 60%, can be 40 to 60% failure rate. So I think it makes sense to use it in certain cases where you're having a rotator cuff tear repaired and you fall into a group that is high risk for healing. And so I think use at the time of the surgery, use of PRP or stem cells can help you, increase your chances of having successful healing from the surgery. But when we do repair rotator cuff tears, we know that there's some people who don't heal the repair completely, but they still do well. And just to review the anatomy, your rotator cuff is a bunch of four tendons that help you rotate the arm in different into different positions. And it helps you, they're not powerful muscles, they're basically positioning muscles, but we rely on them for activities of daily living. So if you do have a problem with your rotator cuff, you're going to find it difficult raising your arm, pushing and pulling. So this is just an arthroscopic picture of a rotator cuff tendon attaching to the top of the arm bone, the humerus. And so that's on the left is the normal rotator cuff, and then this is the tear on the right. So that kind of gives you kind of a mental image of what's happening to the tendon when we repair a rotator cuff. If this is the tear, that defect that we see on this in these arthroscopic pictures, this is to the right is the repair. So going from the tear to repair, we may actually inject some PRP in there if you're at high risk for not healing. Okay, so what are these high risk groups? Okay, so let's say you've already had a rotator cuff tear repair and it doesn't heal, and you're thinking of having a revision repair or like to have the repair done again. So in that situation, I think you can increase your chances. If the rotator cuff tear repair did not heal the first time, I think just to repair it again in the same fashion, to me, doesn't make too much sense. I think basically that's a good time to offer a patient use of PRP to help that second surgery heal. If you're an older person, we all lose our ability to heal. Our ability to heal basically decreases with age. And there's really no way to kind of, go back to the way that you were 20 years ago. So PRP can help your healing in these situations. So if you're a diabetic, if you're a smoker, being diabetic or smoking significantly will decrease your body's ability to heal. So that may be another situation where we can help the healing by giving you PRP. And so there's good scientific evidence that it does help healing. And for example, these two papers, again, at Seaview Orthopedics, we do try to do, scientific medicine. And that's the end. So I think we're going to open up for questions.
Yes, so we did have one.
What should I do? Oh, sorry.
Sorry, just taking care of some echoes happening here. We did get one question from Facebook. So I'm gonna read that out loud, and then nobody add anything to the chat. Feel free to type up now, or once we answer this first question, then you can be free to unmute your mic. So the first question that we had was, does regenerative medicine work on arthritic hips?
Well, yeah, I think that I think that is a good application. I think arthritis is fundamentally the same, whether it occurs in your shoulder joint or your knee joint or your hip joint. It's the main or one of the main pain generators in arthritis, osteoarthritis of any joint is inflammation. So if you can decrease the inflammation, you can help the patient feel better with respect to any joint.
All right, so does anybody have any questions? If you do, you can feel free to unmute your mic right now and ask your question.
How do we get this slide off?
Does anybody have any questions that they want to ask? Oh, we did get one in the chat. Does PRP work on chronic IT band pain of the hip?
Yeah, it can. I think it's a reasonable thing to try if a patient has, failed extensive conservative treatment. Chronic iliotibial band syndrome, whether it affects the hip or further down closer to the knee, is a situation where there's chronic inflammation and chronic irritation of a tissue, and probably also chronic development of micro tears. Okay. These are tears that are basically the result of chronic repetitive use of a tendon or a ligament. And in those situations, the body can heal that injury, but it poops out. So if we can kind of inject PRP or stem cells in that area, there is a potential to boost the healing and resolve the pain. So any PRP and stem cells or orthobiologics can be applied to any situation where there's chronic soft tissue inflammation, what we call tendinosis, where essentially there's the body has basically pooped out in its attempts to heal that condition or that situation.
Does anybody else have? Gotta unmute myself. Right. Does anybody else have any other questions for Dr. Chern? Oh, wait a minute. Just in case anybody is shy or typing, feel free to type in the chat if you don't feel comfortable unmuting. Give it another minute. All right, so it seems like that was our final question. So we're going to go ahead and end there. Thank you all so much for joining us tonight. And thank you, Dr. Chern. That was incredibly informative and insightful. Dr. Chern is currently accepting new patients. So if you would like to book an appointment, you can do so online. If you go to www.cvuortho.com. In the bottom right-hand corner, we actually have a new virtual little chat bot that can help you book an appointment. Super easy and quick. Like I said before, this presentation is being recorded, so this will all be sent to your emails. You can look out for it soon. Within the next, probably 2 days, you'll have that sent to your email. As I mentioned before, we do host these about every other month with different physicians in our practice. So if you want to stay up to date on that, you can go to our website, click on the About tab under upcoming events, or you can follow us on the social medias. We are on Facebook, Instagram, and TikTok at Seaview Ortho. I also want to do a quick little plug. We are so excited to be hosting our 3rd annual Fall Family Festival on Saturday, September 23rd at our Homedale office. There's going to be food trucks, live music, a petting zoo, games. It's going to be a lot of fun for friends, family, and everybody. So we hope to see some of you there. And if you, once we send this to your email, you can feel free to share it with any friends. So thank you all so much for joining us. Thank you, Dr. Chern, again, and we hope to see you guys soon at another virtual event or at our Fall Family Festival. Have a great night, everybody.